family medicine doctor. I did my residency at LSU, Louisiana State University, in family medicine. I went to St. Matthew's University in the Cayman Islands, and I did my undergrad in Chicago. So I've been all over the place, from Chicago to New Orleans to Tampa to Cayman. I mean, all over the place. I think it kind of makes me who I am today. Just getting a different culture, different cities, and being able to relate to patients from all over the world. So it's kind of cool. I think the best thing about being IMG is we're just a lot more hungry. Where I feel like when you come to the United States as an IMG, you're always kind of looked down upon, and you're always second to a US grads, and it just makes you more hungry. It makes you want it more. It makes you work harder. It gives you a push. And I feel like in medicine, if you don't have a push, it's really difficult. Most IMGs that I've worked with always, and I'm not saying that they work harder than US grads, but because we're looked at second, we always are the ones looking up things in the morning, staying in the rounds longer, asking questions, pushing that extra work just to be able to be on the same level as a US grad, which, it just makes us hardworking. And you can be the smartest person in the world, but when it comes down to residency, you got to be hardworking. If you're not hardworking, it just doesn't work. And so, being an IMG, getting prepared on working harder than everybody else around you just to make it into residency. By the time you get into residency, you feel prepared, at least, I want to be completely honest with this topic, because I feel like this is a very sensitive topic for IMGs, because internal medicine and family medicine is kind of what people apply for, because that's the highest chance of getting into residency for internal medicine and family medicine. So I feel like a lot of people that do love cardiology or do love any other specialty, going into orthopedics or dermatology, obviously there's people that love that. Just being an IMG is very restricted, and there's the chances of getting in is a lot less. So they kind of lean on family medicine. But primary care has changed so much from 10 years ago to now. Previously you go to the emergency room, you can get a referral, go anywhere you want. Now I'm the quarterback. If you were to ask any person what position you would be on a football team, you would want to be a quarterback. And I decide what specialists get to see my patient. And in my clinic right now, I really don't send out unless it's absolutely necessary. I do every type of injection. I do every type of biopsy, shave biopsy, excisional biopsy. I do everything in my office. And I love the fact that I could still do that in the office. I can go in a hospital, deliver a baby, then I can come back out and do an there's so much diversity that you can do. So when I first applied, obviously I wanted to do orthopedics, and orthopedics is a very difficult field to get into. And I kind of lean toward family medicine. So I want to be honest during this interview for everybody. And I think once I started doing it, and I'll tell you one thing, family medicine, you have to have a personality. You have to be able to relate to patients, and you really have to care, because if you don't care, you don't succeed. And I think the reason that I'm successful in my field, because I actually care. When somebody's complaining about pain or having actual symptoms, I feel with them. And I've been through so much as an IMG that when that person complains to me or has a struggle or has something that they're having a difficult time in their life, I feel like I can relate to them. And patients know. They know when you're genuine. They know when you're actually wanting to help them. So I don't regret going into family medicine one bit. I just recently opened up my own office, which, is amazing. I'm doing very well for a family medicine doc, and I love what I do. I would say in the first couple of years, maybe not so much, but right now I love it. I wouldn't trade it for any other job in the world. So I'm going to be honest with you. And I feel like this interview is, lay it out and let people see the real truth, because people sometimes hide from the truth. When I did take my step one, I failed it the first time by 1 point, which was probably, it's a sensitive spot. I don't want to get sensitive on this, but it's probably one of the hardest things I've ever had to do in my life, is to overcome that step one and kill it the second time, which I did amazing. I just didn't know how to take an 8-hour test. I feel like I wasn't really fully trained for something like this. It was things that I studied so hard, and I felt like everything I studied for just wasn't on the test. And one thing that the residency program asked me was, why should I choose you over the next person behind you? And my answer is I had a failure in my life. I overcame that failure in my life. There's a lot of people that get into residency that have never failed anything in their life. And when they get there and they get into an obstacle and they can't overcome it. So I told them, I said, I've shown you I can overcome it. I failed it by a point and came back and got a 97%. that's something that I can overcome. So if I get a residency where I'm not sleeping, I'm stressed out, I'm depressed, I've shown you that I can overcome it. The guy behind me that's never failed his entire life, he might not be able to do it. And, you know, being an IMG, applying for a university program, is not easy. You know, it's not easy at all. What I did is, and, you know, this might not be related to the question directly. So what I did is I did a rotation in Louisiana. And what I did is I looked up all the old residents, chief residents that was in that program. And I applied to do a rotation in that program with those chief residents so that I can get a direct contact with somebody in that university. Because as an IMG, you're always looked down upon, right? Until they see you. When they see you in that room and they see your medicine and they see your confidence and what you can do, it changes everything. Because I guarantee you, every IMG always says, just give me a chance. Let me show you what I can do, you know? And that's how I felt. So I looked up everything. And when I went into that residency interview, there was not one resident that knew more than me about the program. I knew every rotation. I knew every doctor. I knew everything about the program director, where he went, what he did. By the time I went into that interview, you know, when let's say there's 6,000 applicants and they interview 60 people and they pick 6 people. I started out on number 60. By the time I was done, I was between 1 and 2, just by meeting me and being prepared for those interviews. No more than that person that's interviewing you. Don't look nervous. Be confident. Show them that you are ready for this program, because if they feel that you're not ready and you're an IMG, they are not going to put you ahead of a US grad. So I found it really difficult, but I did my research and did all the right things. And when I applied, I became very close with the program director, and it was awesome. To prepare for residency, that's a tough question, especially when you go into family medicine. You know, it depends really on your OB rotations, on your internal medicine, how busy is your hospital. When I applied, I feel like there's no real way to feel 100% prepared for residency, right? Now, you could read all you want, you could do all you want, but when you get a code and your heart rate is beating and you got people watching you and they say, doctor, what are you going to do next? You could be number 1 in your class and have gotten 99 percentile on every test. But that moment that person is coding and dying and he's your hands, what matters is how calm you are. How are you able to use what you were taught into a clinical scenario? So these are the biggest things. And for the fact that I've had such a tough time going through all these obstacles and people doubting me, telling me I can't do it, it just gave me the confidence that when I get to a moment where somebody's there and I need to save their life, I'm not nervous anymore. I've been rejected in my life. I've failed in my life and I've overcome it. So like, I keep talking about this, but that's what gave me confidence. My first person I coded, I brought him back to life. It felt amazing. That's what really made me even love medicine more. That moment when that person was almost dying, family members freaking out, and brought him back to life. It's the best feeling. It's worth all the schooling you did for that moment. Preparing for it is from the day you're born. You know, some people got book smarts, some people got street smarts. When you combine both together, that's what really makes you different. And a lot of IMGs had to travel to different countries, different places, adjust to a whole different culture. It makes us different. It makes us special. And when people say special, it doesn't mean bad special. It makes us powerful. And it makes us, honestly, to me, stronger than most other candidates. Because like I said, that person passes out in front of you. Does it matter that you got a 99%? If that person dies in your arm, 99% means nothing. That person is dead. So your clinical experience makes a difference. When a lot of IMGs, if they go into a rotation, say it's easy, this person's just going to let me go. No, don't do that. Let him be hard on you. Let him yell at you. Let him drill it in your head, because you're already a step under that US grad. So you always have to be a step ahead, an hour earlier than everybody. Stay an hour later. During my rotations, when the residents would say, I need help, I would always be the first one to jump on it and always do their notes for them, because that's what made me better. Don't hide in the background as an IMG. I'm an IMG. I'm going to hide in the background. No. Show them who you are. That IMG are 3 letters that don't mean nothing. It's what you do in your life as a doctor is what means everything. You know, I want to talk about a little bit of a scenario. Earlier today, I had a patient that talked to me. 2 years ago, I saw her. She was suicidal. She called me in her worst time. Okay. And she said, that's it. I want to end my life. Okay. It's a sensitive topic for me. And I brought her in right away. I said, come into the office right now. I told cancel all my patients, bring them in. I sat 2.5 hours with that patient, okay? I canceled those patients. That patient is alive today. My social skills is what saved that person. It's not my 99, it's not that. It's how you can relate. How much do you care? Because I always say this, you can be from Harvard, which is great. You're the smartest person in the world. If a patient walks into that room and tells you, I have pain or I have something, the symptoms that they give you, if you don't care, then it only benefits you that you went to Harvard. It doesn't benefit the patient. So caring, understanding, listening to the patient. I always say it's key to listen. Most doctors always want to override the patient, show them I'm the doctor. No, tell them I've been there. I understand. Make them feel as if you are really caring about them. I feel like that makes a huge difference, especially in family medicine. Okay, the first thing I would recommend, and this is the best advice you're ever going to get in your life, on day one of PGY1, on your first year of residency, this is what I did, and it helped me throughout the whole residency. If you are a resident and you're saying, oh, I'm an MD, I'm better than everybody, you're going to do horrible. The first thing I did is I went and I met every single nurse, every MA, every phlebotomist, every single specialist. I introduced myself. I showed confidence. And I tried to be friends with these people because these are going to be your family. These are the people that are going to save your life. Believe it or not, those nurses are much smarter than you are coming in. They've got the experience. You're nervous. You want to be there. As long as you're one unit, one team, when you start your first year, it goes way smoother. You do not want to have enemies on the first year. Don't act like you're better than anybody. You're an intern in there. Go in there. Be friends with everybody. If you're in a certain rotation, if you're in OBGYN, read up the night before on every type of case. Like if you're going to get a shoulder dystocia or you're going to get a cord prolapse, what are you going to do in that situation? Read up on every case for OB before you go there so that if you are an IMG, you are ahead of the curve so that no one even looks at you. Now, once you're in residency, they say they don't look at it too much. They kind of do. Where did you go to med school? That's the first question everybody asks in there, But if you go there and you're nice, you introduce yourself, everybody meets you, they don't even remember that you're a foreign grad. They remember you as who you are as a human being, okay? But if you're over there, you're nervous and you stand out and I'm a foreign grad, I'm gonna hide in the back. That doesn't work. So meet all the nurses, meet all the specialists because you're gonna use them, every single one of them. Know them by first and last name. I went and I introduced myself to every specialist, took his first, last name, took his phone number, told him I'm going to be working with you. Please, if you need anything, let me know. So my advice is meet all the specialists, meet all the nurses, go introduce yourself to everyone. Don't rush out of there on day one, try to be home at 3 o'clock. Stay extra, help them out, help the nurse. If a patient is falling or a physical therapist is helping somebody and he's losing control, go help him. Doesn't mean that a physical therapist is under you or above. No one is above anyone. Everybody's in that hospital to save lives. You are an intern. You are a first year. So you need everyone around you to get through that first year. From day one, I never, ever thought I was better than anyone, okay? Especially as an IMG. When you are treated as an IMG and then you go belittle a nurse, you are doing the same thing they did to you, okay? Those nurses are as important as you are and maybe even more, okay? They spend all day. When I had patients in the ICU, guess what? That nurse has been with them for 12 hours. She knows everything about that patient. If you need anything, she will tell you. If she doesn't like you, she will not help you. And then you're an IMG struggling too. So you need to be nice to everybody. Treat everyone with respect. Nobody's above anybody in that hospital. I don't care. Whether you're a cardiologist, orthopedic, dermatology, family care, nurse, everyone there is on a team, okay? The best player on a team doesn't always say I'm a best player. He will never win a championship. Somebody that wins a championship is that passes it, gives some assist, gives credit to the people that deserve the credit. And that's just how I worked. By the time I left, I felt like every nurse was my family. Every doctor was family. I still communicate with all of them. And honestly, a cool story, Kareem Abdul-Jabbar's son was an orthopedic doctor at LSU when I was there. And when we first started, I felt like he was, not so much with IMGs and stuff like that until he saw my clinical skills, until he started seeing how I was with other people. Then he loved hanging out with me. He wanted to be around me. He didn't even want to hang out with the US grads. So I'm just saying, you have to be nice to people in order to get, you know, your success, especially as an IMG coming in as a PGY1. Some of the challenges I feel like in family medicine is that you have to know pretty much every field, you know, whereas a cardiologist has to know the heart, you know, a neurologist knows the brain. Family medicine, we know a lot, but we don't perfect each one. And what I would recommend if you're ever trying to do that, especially with family medicine, because some people in family medicine go into OB. Some people in family medicine do a specialty in sports medicine. Some family medicine docs do ER. There's a lot of things that you can do as a family medicine, but the biggest challenge is that you have to go from one day rounding in the ICU to the next day going to deliver a baby to the next day, you know, cutting out a cancer from the skin. So that was one of the biggest reasons I liked it. I was able to do everything and get a little bit of each little thing. The tough part about it is when you have to take the board and you've been doing, you know, hospital rounds and now they're asking you about a baby delivery. It's a little bit tough to try to keep all of those and, you know, keep up with everything and get all the guidelines on every single field, whether it's pediatric, whether it's OB, whether it's whatever field it is. It's hard to perfect every field in family medicine because we got so many things we need to know. Number one. Number two is we're the first stop. Anybody that has anything goes to a primary care first. So yes, the best position on the football team, like I said, is the quarterback, right? But he also has the most responsibility, right? So when somebody goes to a hospital and they discharge them, they don't care. They discharge, you take care of it. A cardiologist finish a procedure, you take care of it. Every problem, whether it's a problem with their kids, mom, sickness, everything is through us. So being the quarterback, a lot of times, yes, it's great. You're throwing touchdowns. Everything is going beautiful. But every now and then you throw an interception and it's very difficult, you know? So being the first stop and deciding if you need to send to a because I had somebody the other day says, Doc, please don't send me to dermatology. They charge me, you know, a $50 copay or $100 copay, and I don't have the copay. Now, if you're a family medicine doc that doesn't do procedures, that doesn't do injections, that doesn't do any of that, what's tough? Because now you're sending everybody out. That was the one thing that I wanted to do is I wanted to do everything. If I needed to deliver a baby, I'll deliver. If I need to cut out a cancer, I'll cut it. If I need to do a knee injection, I'll do it. So being a primary care is tough because you got to decide when you need to send it to a specialist or not. And you need to know what you're good at and what not, because if you think you're good at everything and then you harm the patient and you cut them and now they have an injury, it's on you. So I think that's one of the hardest things about family medicine. My patients will beg me, please don't send me. If they had a choice for me to do a cardiac cath and open up or do a CABG or open heart surgery, they will literally want me to do it because they feel secure. They feel like I am their family member. I have patients that literally feel like I'm their son. Like when they have a problem in their life, seriously, they literally will come at my door. Please, I just need to talk. That's how they feel. Now, it is tough because everybody's lifestyle, everybody's drama. Now, that's why a lot of doctors don't get very personable because then it's a whole different field you want to go into. But for me, I'll give you an example. I had a patient, right? So we're talking about family medicine. Now, there's two options that this way it can go, okay? I have an obese patient, and it has happened to me, okay? I have an obese patient that's, severely overweight, that has cardiovascular risk for a heart attack or a stroke, and there's two options. One, I tell him, hey, go diet. Well, what the hell does diet mean? When a patient says, when you're a doctor and you tell a patient go diet, what does that mean? You as a doctor might not even know what diet is. How are they supposed to lose weight when you tell them go diet? Like, I literally sit there and I come up with a meal plan for my patients. And so, one, you're a doctor that just says go diet, don't care. Then that obese patient gets a heart attack. And now, you see what I'm saying? That's one situation. Situation two, I had a patient, 86 years old, severely overweight, having marital problems, knee pain, can't do anything. So I was like, you know what? I'm going to change your life. He's like, oh yeah, that's what every doctor says. I was like, no, I'm going to change your life. I gave him a diet plan. I did weigh-ins every week. I called him on Friday and I said, hey, I don't have a lot of time, 10 minutes. Tell me what's your weight, what you're eating. I got him down 85 pounds. Imagine at that age. Now he's golfing. His marriage is better. His sex drive is better. He's able to do the things he wants. No heart attacks, or he doesn't need to see the cardiologist. So that starting point of what you're going to do
As a primary care, it's all in your hands. You decide where it's going to happen. You see what I'm saying? What's going to happen to that patient is in your hands. That patient, I could have just told him, diet, don't worry about it. He could have ended up in a heart attack, divorced, miserable. That one little thing of me believing that he's going to lose weight and spending an extra 10 minutes a week, 10 minutes. Imagine what that does for you. 10 minutes a week, 40 minutes a month, change the guy's life. You know, saved him from a heart attack, saved him from a stroke, saved him from dying. Now he's confident, he feels good. When he comes to my office, he just buys a brand new shirt. He looks good, he feels good about himself. I love that. That's why I did medicine. That's why I became a primary care, because I love the feeling of people transforming or getting healthy and feeling good about themselves. Because sometimes mental health is as important as anything else. Giving somebody a little bit of confidence can go a long, long way, making them feel good about themselves instead of calling them fat. Don't call a patient fat. That's not right to do. You know, if somebody's overweight, there's different ways to use those words to help the patient grow, to lose the weight, to feel better about themselves. Because if you don't give them the confidence and they're not getting it from their family, they'll give up. You can't give up. You have to be there for them. You got to educate them, help them. You know, I always say this, don't just tell a patient, quit smoking, lose weight, diet. Well, anybody can tell them that. You don't need a medical degree to tell somebody diet. Tell them what to do, adjust it for them, help them, spend that extra 10 minutes to save their life. Now, you can't do that for everybody, but the patients that need it, you need to do it for them. You have to. If I was a program director, one of the biggest things is that people need to understand that the program directors have higher power too. There's a chair, there's other people that there's requirements that they need. There's no choice. So for example, and this is where Match a Resident comes in very, very, very handy. And it was so helpful for me. Before even getting the interview, so you can have, you know, everything that you want and have great letters of rec, but if you can't get into that first step, which meeting the requirement for step 1 and step 2, and passing CS on the first attempt, whatever the requirements is, it doesn't matter if I'm a medical director to see that person. Now, if that person did meet the criteria, okay, if the patient met the criteria, and that's, like I said, why Match a Resident helps, because you sit there, you're a broke medical student, have no money, you're like, what program do I apply to? I don't know if they'll accept me. If they won't accept me, boom, let me go $25 application. I'm gonna send to 2,000. Now you're broke and you're applying to programs that literally will take your file and shred it. And I actually did interviews previously. They will not look at your application, right? So why waste all that money, time, and resource? Focus on the ones that will accept you. So go to Match a Resident. They'll tell you which ones to apply to. And then when they give you that list, perfect that list. Understand what that program requires and see if you've had other people from your medical school in there, because it makes a difference. If you apply to a program where the chief resident is from St. Matthews, like where I went, and I go see him and somehow he knows me, it will make a difference. And I think Match a Resident does offer that. It tells you if there was people, residents that were in your medical school there, which is kind of cool. They can kind of guide you on where to focus. Don't spend time. If you're an IMG and you have failed attempts, don't try to spend all your money trying to apply to Harvard. I'm not putting anybody down, but increase your chances into the programs that will accept you, that want to accept you, right? So as a program director, a few of the challenges would be, obviously now they will pick a US grad over an IMG, 1. 2, you do have to have the step scores. Now, once we get past those 2 things, then obviously letters of recommendation, that's a big thing. Now, if your letter of recommendation is very generic, and it's, oh, he's great, I love him, and they overdo it, then when I read that, I'm like, oh, that could be his uncle, it could be somebody. It doesn't mean nothing. Personal statement is so important, because if I so when I was interviewing people, medical students in residency, right, I would have a file this big. When I read that personal statement, if it's boring, well, I was wanted to be a doctor since I was 5 years old, it's boring. Don't. Give them something unique about yourself. It has to be unique. You have to grab their attention. It has to be, why do I look at yours over the next person? Okay, these are the challenges, you know? And you really don't know as a program director if that person's hardworking or if he's good with patients, how his clinical skills, you really don't know. You haven't worked with him. So you're going off of scores, you're going off of, you know, letters and letters of recommendation and personal statement. So you need to focus on those things. But that's why we go back to the first thing we talked about. Don't waste time trying to apply to a whole bunch of programs that will not accept you, you know? So those are some of the challenges that I would say. I went to St. Matthew's University in the Cayman. Dr. Z, who's my biggest role model in the world, he went to St. Matthew's, and growing up, I just really looked up to him. He was the coolest guy. He was the coolest person in the world to be around. Always like uplifted you, gave you confidence, made you feel good about yourself. And he's kind of somebody that I looked up to. And honestly, I wouldn't say that I was my whole life wanting to be a doctor. I thought I was going to be in the NBA or something, But when I saw Dr. Z do it, and this is kind of a cool story. I was at a wedding, and when we had a whole bunch of cousins at the table, and one of the guy goes, "Oh, look, doctors and a janitor." And he told me I was a janitor, And I told Dr. Z about this, and he was like, "You're going to be the best doctor. I guarantee you're going to be the best doctor. You're going to get through residency. You're going to do this." He was my biggest motivation. And honestly, throughout all of residency, he's kind of guided me and a lot of my friends through this program. And I just feel like he does it from his heart. You can tell when somebody's genuine and when somebody's not. And I just feel like he's done all these things, honestly, for people, for IMGs that are sad, that their whole family is counting on them to be a doctor or whatever it is he feels with them. So he was probably my biggest motivation to go into medical school and residency. I want somebody that wants my programs. I don't want somebody that's going to put my program as, just in case. And trust me, we know just in case. When you're getting an internal medicine letter of recommendation, applying for family medicine, we know you don't want to do family medicine. It's your backup, okay? Understanding the program. And when we first started talking, I said, I knew everything about the program, right? So when I get a candidate that tells me, "Oh yeah, I know we do pediatrics in this hospital. I know the doctor that does it. I know where we do it." So guess what? When this guy starts day one, I don't need to waste my day trying to tell him how to get to a hospital, what the name of the doctor is, how to do the rotation. He's already looked all that up. I want an applicant that wants my program, that knows everything about the program and what we stand for, knows the name of the residents already, so it's not too much adjustment. When you walk into that program, know every one of those residents by first name. Hey, Mike. Hey, John. Show them that you love this program, that you have no other program in mind other than this program. Do not show programs that they are backup programs. Trust me, they understand and they know when they're backup programs. Don't make them never make, if you're going to make it a backup program, don't apply there. One of the hardest things for being an IMG was for me is that when I took step one, my wife was pregnant and almost due, and 4 days before the test. And as people know, you can't cancel the test. I think it's 5 days, and it's very expensive that time. I didn't have any money. And then my wife ended up losing the baby, and I took the test and ended up failing by 1 point. And the worst part of that whole thing was for me is that the dean of the med school called me up and was like, "Do you understand that you're a foreign grad and that you failed step one? You will never get residency. This is something that we talked to you guys about. And then, just imagine losing a child. This was supposed to be the first boy in the family, failing my step one, being an IMG, being told that I will never make it. I will always fail in life." That moment in my life was probably the lowest moment in my life. And it's kind of hard for me to talk about during, especially on like a Zoom meeting. But I just feel like people out there that are having a really tough time because, when you're in IMG and you're having a tough time getting residency or a tough time, it's literally one of the most depressing times of your life. And literally you can never feel lower at that moment. And I never felt lower than that moment in my life. And I think, at that moment when I called Match a Resident, when I called Z and I told them, "Hey, I failed. I'm sorry to let you down. Everybody's saying I'm going to fail. I'm never going to make it." And one thing that he did is he looked at me and he said, "I promise you, you will be a doctor. You will get residency. You will do this." And probably one of the most inspirational things that's ever happened to me. And when I did, when I rocked step one the second time, the first person I called was Dr. Z. And it was
probably one of the most proud moments of my life. And I've never seen anybody more proud of me that I did pass it, that I did overcome it. No matter what I went through in rotations of you know, doctors being mean to me more than the US grads, putting me down, calling me a failure, I still got up every single day and pushed and pushed and pushed. I said, I will not let somebody bring me down. And that moment when Dr. Z told me, you will be a doctor, you better believe in it now, is when I changed my mentality. Get away from the mentality that you're an IMG. Get away from that. Push yourself. Focus more on the medicine than what people say, okay? Do well on your exams, that's important, but it's just as important as to learn everything during your rotation, to get your confidence. You are gonna go through obstacles, you're gonna fail, you're gonna go through these things, but it makes you who you are. I am an IMG family medicine resident from LSU. I'm doing wonderful right now. I have my own office. I love what I do. I love my patients. And IMG did not stop me from any of that. So I'm proud to be an IMG. I'm proud to have went to a great residency program. And I just want to thank the people that have been there for me, and especially Matcha Resident that helped me through this whole process. And you know, when I applied to apply for residency, I was really broke at that time. You know, I didn't have any money. I was having a tough time, smacking my battery to start. And I called Dr. Z. It's like, man, I'm broke. I don't know how many programs to apply to. He's like, okay, don't worry about it. Two minutes later, I get a code for free, you know, and I applied and he did that for me. And I honestly, Matcha Resident is not paying me. I have nothing to do with that. I think it's just really has helped me. And if I feel like people can connect with that and understand, it will make a difference in your life. Thank you.